Every spring for over 3 decades, the National Association for Home Care and Hospice and its members have come to Washington, D.C. to renew their commitment to millions of patients and providers across the country by advocating for them in the halls of Congress. It is so important for members of Congress to hear from their constituents, actual patients and providers who can educate them about the benefits that only come from home health and hospice. March on Washington brings more home care and hospice advocates to Congress than any other event. The March on Washington is truly one of a kind.
We believe the most important thing is to make sure our members of Congress are well educated on the value that home health and hospice providers offer to patients in the healthcare system.
The fact that we can put a face to a name with our members of Congress, they can see us, they can tangibly associate us with the industry is so important. And I think the value proposition of home care and hospice, that we meet that triple aim of better care, better outcomes, and lower costs. And as time goes on and the cost pressures increase, we become more important. So I think it's important for us to continue to drill that message home and to continue to keep an open dialogue with our members of Congress.
Did the NAHC policy briefing prepare you to meet with your congressional representatives?
It did. There's just so much to know. So to have it synthesized in a way where, what are the top important things, that's always beneficial. So I would encourage anyone to come to March on Washington.
And I think the briefing we had yesterday afternoon, really helped, solidify those main points that we want to get across. It was helpful.
The first part of this is you have to keep this going after you leave here.
The NAHC policy team, I think, did a good job of communicating to us. Take all this information, synthesize it as you think it's best fit for your members of Congress, and then talk to them about it.
The entire team did a wonderful job of really putting in place some of the key initiatives that everyone that's coming that cares about home health or hospice, and both, prepare yourself to just be educated about what's in play today and how you can make a difference just by communicating with your representatives.
NAHC does a really wonderful job of preparing everybody and making sure that both the staffs of the members are very organized, and the participants from each of the constituent communities are very well positioned and educated on the issues.
Not yet for your advocacy tomorrow. How many of you represent or are from a home health agency that does Medicaid?
With the knowledge and material gained from the briefing by NAHC's policy staff, home care and hospice advocates are ready to prepare and strategize for meetings with their congressional delegations. But while the purpose of March on Washington is to advocate for better policies to serve America's growing elderly and disabled population, bringing so many home care and hospice leaders together in one place creates a great opportunity for networking. Industry leaders have a chance to catch up with one another, swap stories and tactics, and emerge with new friends and contacts and new ideas about how to make their businesses run better than ever.
Our highest priority is making sure that our members of Congress understand the importance of adequacy of payment and coverage for home health and hospice benefits, and that the finer points of policy matter a great deal.
I'm very passionate about is allowing nurse practitioners to really enable them to refer patients to home care, and then also give them the ability to sign off on those orders.
We're really trying to get nurse practitioners to be able to sign orders for home care. It's a no-brainer to us. Everyone sees a nurse practitioner, so why not home care too? So that was our number one priority. We do have 7 members in our congressional delegation that have already signed on, so we thank them for that, and we're hoping to convince the rest.
Everybody was accommodating with appointments and very friendly and very open to what we had to say. And they were asking questions. And sometimes we have to go back and do a little bit of research and get back to them. But when they ask questions, we know they're engaged with our appointment.
It's surprisingly easy and fun to do. You call, you make the appointments. As Cheryl said, they're very accommodating. They're used to constituents coming in, and so they know that you might not necessarily know all the technical ins and outs of the legislation, but that you really have a passion in your heart for your issue, in our case, home care and hospice, and you do have important stories to share. It's very easy. We just made a little handout, we slid it over to them, and then we could reference, see first point on our handout, second point on our handout, and just go through that, give them something to keep, and then they know our names and faces and we know them.
I think NAHC does a great job, and we really just need to promote this more. I think everybody needs, the bigger and louder voice that we have from all companies in our industry, the better off we're going to be.
Will we see you back at the next March on Washington or soon?
Definitely.
For over 30 years, NAHC has brought thousands of home care and hospice advocates to Congress to defend the rights of patients and providers, and we will continue to lead that fight until it is won. We hope you will join us, and we look forward to seeing you at the March on Washington.